So you've heard of type 1 and type 2 diabetes. But do you know about type 1.5? Type 1.5 is also known as LADA, Latent Autoimmune Diabetes in adults. What is LADA exactly? Meet Larry, the LADA pancreas.
LADA is an autoimmune disease just like type 1 diabetes. It is often mistaken for type 2 due to its slow onset progression, which causes it to develop between the ages of 30 to 50.
Antibodies from the immune system destroy insulin-producing islet cells in the pancreas, which means insulin therapy is required. The symptoms Larry started to experience include increased appetite, excessive thirst, blurred vision, numb hands and feet, fatigue, weight loss, frequent urination, and wounds that take longer to heal. Larry decided it was time to see his doctor.
Hey doc, I need your help.
What's wrong, Larry?
Larry explained his recent symptoms.
It sounds like you have type 2 diabetes.
Really?
Here, take these type 2 meds, they should help.
Larry felt confused because he is healthy and active, but he listened to the doctor and took the meds. Type 2 treatments quickly become ineffective as insulin therapy is needed for type 1.5 diabetes. After taking the type 2 meds, Larry began to feel much worse than before. Prolonged misdiagnosis can have serious health implications, such as kidney damage, vision loss, nerve damage, painful muscle cramps, and DKA. Diabetic ketoacidosis is a serious condition that can result in comas or death. This occurs when there is a severe lack of insulin, so the body starts to break down fat too quickly. Blood ketone levels get dangerously high, resulting in the blood becoming too acidic. Once a person has DKA, they need urgent treatment in hospital, as it can be life-threatening in as little as a few days or weeks. Larry was becoming concerned. He did not respond well to the type 2 treatment and now has worse symptoms than before. He is a normal weight and does not fit the typical profile of a type 2 diabetic. He is between the age of 30 to 50, and he has family members with type 1 diabetes. Larry went back to his doctor to raise his concerns about his previous diagnosis.
Doc, I'm feeling worse. Something's wrong.
Oh no, the type 2 meds should have helped.
The doctor was unsure at first, but Larry was persistent with asking for tests to check whether his diagnosis was correct.
Okay, let me see what I can do. These tests will help to check your condition.
Larry had the necessary tests done: C-peptide, GADA, and glucose levels.
You don't have type 2, you have type 1.5.
Everything started to make much more sense, and Larry was given the insulin he needed. With the correct diagnosis and insulin therapy, Larry feels better than ever.
Don't be shy. Ask your doctor why they've diagnosed you type 2 and not type 1.5.
Spread awareness of LADA to help stop life-threatening misdiagnoses.